temperatures between 23 to 14 degrees Celsius. الداخلية will be sunny, temperatures between 23 to 12 degrees Celsius. North al-Sharqiyya will be sunny, temperatures between 24 to 12 degrees Celsius. South al-Sharqiyya will be sunny, temperatures between 22 to 16 degrees Celsius. Al-Wusta will be partly cloudy, temperatures between 24 to 18 degrees Celsius. And Dhofar will also be sunny, temperatures between 22 to 14 degrees Celsius. Hello and welcome back to Outline. Now with our local stories. Reusable shopping bags must now be used to carry groceries are available at affordable prices following the single-use plastic ban, which was implemented from 1st of January onwards, Oman Consumer Protection Authority has said. The Consumer Protection Authority will be conducting regular checks over sales of reusable bags in shops to ensure that the retailers do not profit off customers by increasing their prices. We want to inform the consumers that the environment-friendly bags are available at the local markets at normal prices, on the basis of the decision of banning the use of plastic bags issued by the Environment Authority, the CPA said in a statement. The CPA also asked shopkeepers to ensure that the bags were sold at fair prices, in addition to requesting them to follow all the rules regarding their use and their sale. Environment Authority has also said that enough reusable bags will be made available to customers who visit supermarkets, shopping centers, and other businesses in the country. Alternatives of various types are available in the local market. This includes cloth bags, paper and reusable plastic bags, and these are ongoing coordination with all partners to provide alternatives to ensure that these are inexpensive purchases for the consumer. The decision to protect the country's environment was made under the Royal Decree number 23/2020. Among the problems posed by these bags are animals dying after choking on them and preventing the sunlight from reaching the roots of the trees, thereby stunting their growth and the leaching of their chemicals into the environment over the long term. And female workers who make plastic bags handle chemicals that increase their chances of miscarriage. Oman's budget is based on assumption that the oil will be at barrel of 17.5 Omani riyals in 2021. This is a marginal rise of 2% over the last year's level. The price of Oman oil in 2021 is lower to 8 Omani riyals compared to 2019, when it only costed 25 Omani riyals a barrel. Oil prices have experienced a decline in 2020 due to the lower oil demand as result of lockdowns and health measures being taken worldwide to control the spread of coronavirus pandemic. The 2021 budget report published by the Ministry of Finance. The world's economic activity is anticipated to recover gradually in 2021, leading to improved global oil demand and better oil prices. Energy Information Administration, which conducted its forecast only in December 2020, expects oil prices to rise to 19 Omani riyals as opposed to the rates of 15.9 this year. All three forecasts expect oil prices to rise significantly in 2021. The most optimistic of them is the Energy Aspects, October 2020, which predicts the sale price per barrel to jump to 22.5 Omani riyals. Sharply reduced demand for oil and gas impacted Oman's economy drastically. According to the ministry's budget guide, oil revenues declined by 1.1 billion Omani riyals last year, when compared to the estimated earnings. Gas revenue dropped to 500 million Omani riyals as a result of a decline in the natural gas price as well as lower sales. Added to that, non-oil revenue declined by 600 million Omani riyals due to the impacts of COVID-19 pandemic. To reduce the effects of economic activity, the government waived several fees and taxes, such as tourism tax, municipality fees and tax, industrial areas rents, commercial register renewal fee, shipping and handling fees and others, which helped fuel the decline in non-oil revenue. Oman's budget for 2021 will act as a template for the next 2 decades. of the country's economic development, the Undersecretary at the Ministry of Economy, said. This plan represents the first cycle of implementation of Oman Vision 2040, and it is considered the roadmap for the next 20 years, said Dr. Nasser bin Rashid Al-Ma'wali, who said that the provisions of this budget were also designed with the 10th five-year plan in mind. This plan is important as it has been driven by the thoughts and vision of His Majesty Sultan Haytham bin Tariq. The 10th five-year plan is a translation on direction of progress His Majesty sees for this country. The Undersecretary was speaking in an interview with Shabiba FM, the radio arm of Al-Shabiba, the sister Arabic publication of Times of Oman, where he explained the importance of Oman basing its economy on renewable resources for it to be sustainable in the long term. This plan seeks to transform our country's economic structure, Al-Ma'wali explained. As the plan begins to be adopted, it is important that our economy depends on multiple sustainable resources instead of the ones that can be depleted. Economic expansion and efficient spending are the objectives around which the 5 pillars that support Oman's budget for 2021 have been created. This year's main goals: higher non-oil revenues, economic growth and diversification, optimal public spending, increasing domestic and foreign investment, and enabling the private sector to help achieve economic growth and job creation, said Sultan bin Salim Al-Habsi, the Minister of Finance. The government has adjusted its policies to deal with the present situation in order to maintain the fiscal balance. The budget continues to rationalize public spending and enhance its efficiency. It also seeks to contain the deficit and maintain its downward trend. We truly value the efforts exerted towards the state's budget, he said, and we also affirm the significance of the combined effort of all concerned entities, along with the participation of our society and private sector to uplift our national economy towards achieving Oman Vision 2040. Those were our local stories. Now let's look at our COVID-19 updates. The ministry has announced that the registration of 1 new COVID-19 death, taking the total death to 1,502. The ministry has extended its deepest condolences to the families of the deceased. The ministry has also announced that the registration of 180 new COVID-19 cases, taking the total cases in the Sultanate to 129,584. In the past 24 hours, there have been 106 recoveries, and the total number of recoveries now stands at 122,372. The ministry has urged everyone to adhere to social distancing instructions issued by the Supreme Committee and the Ministry of Health. Now let's go to TTV Studio 2 with Antara Bose, where she will be talking about our segment for today, Fighting COVID.
Thank you, Maitha, and welcome to this special segment on Outline called Fighting COVID. On this show, we cover anything and everything related to our current biggest enemy, the coronavirus. What's happening on the global front, how prepared are we to take on new challenges, and also updates on the new vaccines the world is relying on. We're covering all of that and more. Today, there are 85,506,357 cases of the coronavirus worldwide. And it's been more than a year since the COVID-19 virus was first detected in the city of Wuhan in China. Yes, 2020 has been an eventful year with the coronavirus pandemic that has had unprecedented impact on all of us, be it economical, financial, or even emotional. With several lockdowns in place, travel restrictions between countries, and mandatory precautionary measures imposed by various authorities, the pandemic has affected individuals, countries, and pretty much the entire world. However, while social distancing and masks have become the new norm, if we do look at it in a different light, we've all been united in the pursuit to stay safe, find the vaccine, and rise above this formidable challenge. And 2021 seems promising in our fight against COVID-19. While the vaccines are in place and countries all over the world have started their immunization drives, the battle isn't quite over yet. The latest is that a new strain has emerged, and we'll get to that shortly. But first, let's take a look at some of the important messages the Ministry of Health in Oman has announced last week pertaining to the vaccine. This is what it says. Initiate a quick response and go to the health institutions as soon as you're notified that you are in the vaccine target group. Commit to take the second dose of the vaccine 21 days after the first dose in order to obtain the desired efficacy, as a single dose of the vaccine is considered ineffective. Note that the effect of the vaccine begins 7 days after the second dose is taken, and before that, the person is still susceptible to infection and should go to the health institutions for evaluation if any symptoms of the disease appear. Continue to adhere to other preventive measures such as hand washing, wearing a mask, and physical distancing after taking the vaccine doses, as taking the vaccine will not cancel the need for these measures. Don't pay attention to rumors and take the information about the vaccine from the reliable official sources. With those in mind, now let's take a look at the year that was and the economic impact of COVID-19. By comparing business leaders' responses in 2020 to their answers over the last 3 years, some clear trends have emerged according to reports online. In advanced economies, the top negative impact of COVID-19 has been a decline in competition, which is a decline of 2.9%, followed by reduced collaboration, which is 2.6%, and a growing challenge in finding and hiring skilled workers. Now, to try to understand what is driving this reduced competition in advanced economies, the report suggested that one factor could be the increased use of online platforms. E-commerce is heavily dominated by a select number of retailers. Because of this, bigger retailers like Amazon have seen massive boosts in their online sales, while many smaller brick-and-mortar businesses have been struggling. The negative impacts on advanced economies are centered around market concentration and talent gaps. The problem in developing countries are a little different. We're talking about increase in crime and governance issues. It's important to note that in 2018 and 2019 surveys, organized crime and business costs related to crime and violence were trending downward. Because of this, the World Economic Forum suggests that we consider this year's increase in these areas as a temporary COVID-induced setback rather than a long-term issue. From the reports, it also seems like there have been some positive impacts of COVID-19. In advanced economies, the top positive impacts were government responsiveness to change, which went up by 8.2%, followed by internal collaboration within companies that increased by 4.6%. Interestingly, internal collaboration improved while external collaboration got worse. This is likely because companies had to adapt to changing work environments while also learning how to collaborate with one another through remote working. Internal collaboration didn't just improve in advanced economies. In fact, developing economies experienced several of the top positive impacts that advanced economies saw as well. We're talking about collaboration within a company, government's responsiveness to change, and many other such impacts. Those were a couple of the impacts of COVID-19. Now we'll take a short commercial break and we'll be back to talk about the new strain of the virus.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Fighting COVID on Outline. As I mentioned, we'll be talking about the new strain of the coronavirus that has emerged. And in emerging information about the new variant of the coronavirus, SARS-CoV-2, circulating in the UK, one mutation has been of particular concern. The variant called VUI 2020-12/01 and reported as being capable of transmitting faster among people is defined by many as 14 mutations and 3 deletions in its genetic material. Of particular concern is one mutation, N501Y. While the variant's potential to impact testing and vaccination results are still being studied, health authorities are largely optimistic and most tests and vaccines will still work. Now let's take a look at all the countries that have reported the new strain as of 3rd January 2021. We have a list of 33 countries so far that include United Kingdom, South Africa, Australia, Netherlands, Denmark, Ireland, Israel, Italy, Germany, Iceland, Nigeria, Singapore, France, Japan, Lebanon, Canada, Spain, Sweden, Jordan, Portugal, Finland, Norway, South Korea, Chile, India, Pakistan, Switzerland, UAE, United States, Malaysia, and China. Nigeria and Brazil have also detected new cases recently. In South Africa, another variant of SARS-CoV-2 emerged independently of the B117 lineage. This variant shares some mutations with the B117 lineage. Cases attributed to this variant have been detected outside South Africa as well. Currently, there is no evidence that these variants cause more severe illness or increased risk of death. New information of the biological, epidemiological, and clinical characteristics of these variants is still rapidly emerging. Now, talking about how different countries are responding to this new strain, the Indian Council of Medical Research on Saturday said scientists at its National Institute of Virology had isolated and cultured the UK variant of the SARS-CoV-2 from the clinical samples collected from passengers who had returned from Britain. It said that SARS-CoV-2, the virus causing COVID-19, was being tracked through the countrywide network of ICMR laboratories since early days of the epidemic in India. No country has yet reported successful isolation and culture of the UK variant, the ICMR said, adding that various cell lines were used to culture the UK variant of the virus. The UAE earlier last week said it had discovered a limited number of cases of people infected with the new coronavirus variant in the country, the first confirmed cases of a more contagious COVID-19 mutant in the Gulf region. Those affected had traveled from abroad. The UAE, however, had kept its borders and international flights open. Talking about Oman, a suspension on international air travel had been in place since 22nd December to curb the spread of the new strain of coronavirus. But borders have now reopened following a decision by the country's Supreme Committee. Oman News Agency had also reported on December 21st that Omani health authorities were examining 4 suspected cases of the variant coming from the UK, citing Health Minister Ahmed Al-Saidi. As of today, we're on the clear and no cases because of the new strain have been reported. Now, talking about what experts have to say about the new strain, how infectious is it or how harmful is it? According to an article published in Hopkins Medicine, Robert Bollinger says that although the mutated coronavirus may spread faster from person to person, it does not appear any more likely to cause severe disease or death. He explains that for a virus to survive, it may be more advantageous for it to evolve so that it spreads more easily. On the other hand, viruses don't get the chance to reproduce if they mutate to become deadly. Now, what does this mean for the vaccines? Experts say that there is no data to suggest that the antibodies elicited by vaccines would not be effective against it. According to the European Centre for Disease Prevention and Control, mutations in the new variants relate to the receptor binding site, which may alter the antigenic properties of the virus, and that is likely that some reduction in neutralization by antibodies will be seen. Barry Bloom, professor of immunology and infectious diseases at the Harvard T.H. Chan School of Public Health, says that nobody knows whether the new strains of the virus will be able to escape the immune responses generated by the vaccines. If they mutate too dramatically, Bloom says they would be able to escape antibodies, but it would be harder for them to bind to the host cell receptors, which would compromise their ability to get into cells. Ugur Sahin, CEO of Germany's BioNTech SC, which partnered with US pharmaceutical giant Pfizer to develop the mRNA vaccine rolled out in Europe and the US, has said he believes that the vaccine is effective against the new strain. If it were not, it could develop a new shot to counter a new variant within 6 weeks. If the vaccines are modified to counter a new strain, there would probably be no need to conduct another set of thorough clinical trials like they went through the first time, as long as there are no major changes to the vaccine's production or components. On that note, we'll take a short commercial break and we'll be back to discuss the effectiveness of the new vaccine. What does 95% actually mean? Stay tuned.
Oman's largest online supermarket now has no minimum order limit. From grocery to household items, Rafiq has everything that you want. Enjoy worry-free shopping with over 8,000 products to choose from and get it delivered straight to your doorstep. Rafiq, you order, we deliver.
Welcome back to Fighting COVID on Outline. So as I said, we're going to be talking about the effectiveness of the vaccine and the common term that a lot of pharmaceutical giants use. They say 95%. Now, what does 95% actually mean? Well, for most of us, it means that the vaccine is supposed to be 95% effective. You might assume that 95 out of 100 people vaccinated will be protected from COVID-19, but that's not exactly how the math works. Experts say it's easy to misconstrue early results because the language that vaccine researchers use to talk about their trials can be hard for outsiders to understand. The frontrunners in the vaccine race seem to be working far better than anyone expected. Pfizer and BioNTech announced that the vaccine had an efficacy rate of 95%. Moderna put the figure for its vaccine at 94.5%. In Russia, the markers of Sputnik vaccine claim their efficacy rate was over 90%. So what do the companies mean when they say their vaccines are 95% effective? Let's learn about that bit. The fundamental logic behind today's vaccine trials was worked out by statisticians over a century ago. Researchers vaccinate some people and give others a placebo. Then they wait for participants to get sick and look at how many of the illnesses came from each group. In the case of Pfizer, for example, the company recruited 43,661 volunteers and waited for 170 people to come down with symptoms of COVID-19 and then get a positive test. Out of these 170, 162 had received a placebo shot and just 8 had received the real vaccine. From these numbers, Pfizer's researchers calculated the fraction of volunteers in each group who got sick. Both fractions were small, but the fraction of unvaccinated volunteers who got sick was much bigger than the fraction of vaccinated ones. The scientists then determined the relative difference between these two fractions. Scientists expressed that difference with a value they call efficacy. If there's no difference between the vaccine and placebo groups, the efficacy is 0. If none of the sick people had been vaccinated, the efficacy would be 100%. Now, talking about the authorized and recommended vaccines, the first two vaccines to prevent COVID-19, of course, as we all know it, was Pfizer, BioNTech, and Moderna's. Earlier, the Oxford AstraZeneca vaccine was in phase 3 clinical trials, but has been approved for use in the UK, with the first dose due to be given on Monday, which is today. There will be 30,000 doses available from next week, and vaccination centers will now start inviting patients to come and get the jab. Priority groups for immunization have already been identified, starting with care home residents, the over 80s, and healthcare workers. The Medicines and Healthcare Products Regulatory Agency has authorized 2 full doses of the Oxford vaccine, with the second dose to be given 4 to 12 weeks after the first. AstraZeneca has also been approved by India and most recently by Oman too. Now, coming back to how Oman's immunization drive is going, His Excellency Dr. Ahmed bin Mohammed Al Saidi, Minister of Health, on Sunday visited a number of COVID-19 vaccination clinics in Muscat as part of the national campaign for immunization against COVID-19. The minister briefed on the health workers' efforts in tackling the COVID-19 pandemic and the healthcare services provided for the infected patients. During the visit, which included Al-Seed Polyclinic and Bosher Polyclinic, the minister reviewed the smooth process of vaccination for the target groups, the daily statistics of vaccinations, as well as the mechanisms of receiving the target groups. Furthermore, the minister met a number of medical staff working at these clinics and listened to their suggestions. He also asserted that the vaccine is safe and effective. Al-Saidi added that 7,600 people in the Sultanate had been vaccinated until Sunday. No side effects had been registered other than the expected symptoms for each vaccine, such as headache, body ache, low fever, and skin rash in some cases. The Minister of Health called upon all to not pay attention to rumors and forward to the distributed vaccination centers across the Sultanate. The minister was accompanied by Dr. Thamra Al-Ghafri, Acting Director General of Health Services of Muscat Governorate. And talking about the new strain, there are no indications that the vaccine will not be effective against the new strain of coronavirus, the Ministry of Health also said on Sunday. A statement issued online by Ministry of Health said that making the vaccine as a travel requirement will depend on each country's national policies and on the availability of the vaccine in the quantities that allow it to be used as an additional requirement or as an alternative to PCR test and isolation. For preliminary data, there are no indications that the vaccine will not be effective against the new strain, but studies are still going on about that. The ministry has also shared a call center number, which is 2444-1999, in case there is anyone who wants to inquire about the COVID-19 vaccine. The Minister of Health, His Excellency Dr. Ahmed bin Mohammed Al Saidi, also delivered a few words of reassurance to the people. Let's take a look at that.
There's social distancing. I'm taking the mask off. Today is the 8th day since we've launched corona vaccine in the Sultanate of Oman. I'm glad to say that from 7,600 cases, we have not had a single serious adverse effect. There's only one individual, one gentleman who had a skin rash, which did not require hospitalization. What I'm trying to say, these vaccines are safe and effective. Therefore, I urge everybody who meets the criteria to go to the nearest vaccination center and their government and their wilaya to receive the vaccine. I've had the vaccine personally last Sunday. I had mild headache for a few hours only, which disappeared with simple medications. Also, I need to remind everybody that taking the vaccine will not at the moment be enough without using the other measures such as wearing the mask, keeping the physical distance, hand hygiene, and respiratory etiquettes. Worldwide, almost 4 million people have been vaccinated with the Pfizer vaccine. There have not been any major adverse event reported either. I'm also glad to say that the Oxford AstraZeneca vaccine been approved in the United Kingdom and India. And in Oman, we are we've participated in the COVAX, which is the International Alliance for Vaccine. And most of the vaccine we expect from now on to come to the Sultanate is from AstraZeneca and, of course, other companies. Pfizer vaccine will keep rolling on. We had the first shipment almost 10 days ago, and before the middle of this month, we'll have the second consignment, which is about 28,000 doses. Again, with the new strain, with the fast spread in many countries in the region and worldwide, we cannot, and no country can vaccinate everybody at this stage. We've done very well so far, thanks to all of you, the public, by adhering to the healthy practices that you all know. I urge you to continue the same. We will do whatever we can to vaccinate as many people as we can, but logistically that is not possible, probably before the middle of this year. Our numbers at the moment of cases is comfortable, but we still want to see it going down, and we definitely don't want to see a rise in the numbers. And the only reason to prevent that, the only ways to prevent that are all in our hands. So please keep well, keep your physical distance, wear your mask where appropriately, and I can assure you that the healthcare system in Oman has been very solid, very strong. The support we've had and continue to have from His Majesty Sultan Haytham is huge to keep the system standing and providing the healthcare that you all deserve. Thank you very much to everybody.
That was today's episode of Fighting COVID on Outline. We'll be back next Monday with another episode and more updates. Over to Maitha.
Thank you, Antara, for all the COVID updates. Tune in again tomorrow at the same time for the midday update, and thank you for watching TTV.
You've just heard the live feed from the TTV studios on TFM 95.4. Let's talk.